And then forget about wrinkles, why the key to looking younger is all in your cheeks.
Serving all of San Diego, this is your Fox 5 News.
Okay, Raul, I am told that plumping up your cheeks can be the key to taking years off of your face. It's a new A-list phenomenon, and it's called the pillow face. I'm fascinated by this. Board-certified dermatologist Dr. William Groff is here to show us how we can get the dramatic results. Good morning to you.
Good morning. Good to see you.
All right, so first of all, what exactly is this pillow face thing?
Well, what happens as the face starts to age, you lose volume, specifically in the cheeks, but you can lose it in the temples and around the jawline as well. So what they're doing in Hollywood is that a lot of the actresses are getting volume replaced in their cheeks to make them look like nice little soft pillows, which gives a nice soft look to their face. Now it can be overdone.
I'm going to have her make a, we're going to take a look at her making that.
She's going to make up what we call the contents of the pillow, so to speak. This is a product called Radiesse, which is going to help plump up the cheek to bring back the volume that's lost as we get older.
What's she doing right here exactly?
Now she's mixing lidocaine, which is a numbing solution, with the product itself. So when we inject the product, it will actually numb the skin, which takes away a lot of the discomfort of the procedure.
And then how much does a procedure like this cost?
This would cost her between $700 to $900.
And how long would the results last?
It can last up to a year,
okay,
which is pretty good.
Let's take a look at our model here. Now, you've done half of her face, I guess,
right,
huh?
This is Tasha, and she's a beautiful young woman. She's in her early 40s, but as we get into our 40s, we start to lose volume. So you lose volume in the temples, the cheek, you can see is real flat through here, and you lose volume here and here. So what I did on this side, I placed some volume across her cheek. I placed some volume here, here, and a little bit up here. And you can actually see how she got a lift to her eyebrow, a lift to her upper lid. You can see that cheek looks nice and full, but natural. It's not overdone. And then you can see she's got some nice volume through the fold here, which looks youthful and takes off a few years, I believe.
Let's talk about some of the risks and what can happen if this is done improperly.
Okay, of course. Well, if it's done improperly, some of the common things we see in our office from practices that maybe don't have a lot of experience doing these procedures is lumpiness and bumpiness. You can get actually infection if it's not done properly, but these are pretty rare. So generally it's safe. Of course, it's not unusual to get an occasional bruise or two, but it's very safe. You get a little bit of swelling afterwards, possibly.
Okay, we're going to take a look at some pictures, some celebrities who I guess have had a similar procedure done. We've got Christy Turlington right here.
Right.
And what is it? We got a little before and after action going on?
I mean, Christy Turlington, I think, is the quintessential beauty. In the left photo, this is obviously before she had anything done. Now, her cheeks on the right, you can see have clearly been augmented, I believe, but I think it may be a little bit overdone in her case, but not too bad.
She's still a supermodel.
She's beautiful, yeah. I really like her.
She's got that going for her. Okay, our next picture, we have Madonna coming up, and also Elizabeth Hurley.
Oh, Elizabeth Hurley, yes. So we got Elizabeth Hurley on the left. Now she's got to be, I think she's in her mid to late 40s now, and normally you would see loss of volume in the cheeks. So I'm guessing that she's had some cheek augmentation. She looks great, absolutely beautiful, looks very natural. Now Madonna on the right hand side of the screen, everyone can make their own judgment, but in my opinion, I mean, I've followed Madonna for the last 30 years, through her career. She's definitely had cheek augmentation, and I believe it looks overdone. Too much.
A little too much there,
A little too much, I think.
All right, next we have Suzanne Summers. Little Three's Company action. Okay.
Oh, yeah. So, again, I think this is an example where you can go too far with the facial fillers. It looks unnatural. It looks plasticized, like something's been done. So that certainly wouldn't be my ideal result.
Now, you brought a little food to show us.
Yes.
Show us exactly what we're learning here.
So this is an egg. If I turn the egg upside down, the widest part of the egg is at the top. Now, the ideal shape of a woman's face is more volume at the top, and it narrows as you go down. Now, as women age, and men, that changes. Now there's less volume up top, and all the volume falls to the lower face. So you get the sagging and the widening of the face, which is very Asian.
Okay. Now you're going to demonstrate the other side of her face here with the procedure.
Yeah, why don't we do a quick...
And how long does this usually take?
I can do this in the office in about 15 minutes.
And then people can just go right back to work, right
back to work. You can see I just injected the left side of her face about 15, 20 minutes ago. So you can see she could go right back to work.
Does it hurt? No?
No, not at all.
Okay.
Okay. So can I have the product, please? And a little bit of alcohol. So I'm just going to show you how we start to augment the cheek. So I'm going to wipe it just to clean off a little bit of the makeup there.
And we're not going to show the actual needle injecting.
Okay, so I'll go slow so we don't actually show
turn to me,
that.
I guess.
Okay.
My cheeks. All right.
All right, so I'm going to put a little bit of product in here. And you can see I just put a little bit of product in her cheek. You can come back to it.
We didn't want to make anybody queasy.
You can see there's absolutely there's no bleeding, no bruising, nothing. It looks great. There's just a little tiny bit there, which is easily wiped away.
And that didn't hurt at all? It's a big old needle.
It's not that big.
It's big to me.
Yeah. But we, you know, in the office, we can put numbing cream on the skin to take away any discomfort. We can use ice packs before. So there's a lot of things we can do to help with patients who are a little bit queasy.
Very good. Dr. Groff, thank you for being here this morning. We really, really appreciate it. And if you would like to contact Dr. Groff, you can do so at GBK Cosmetic Laser Dermatology. It's located in the UTC area. And the phone number is on your screen right now, 858-657-1002. We've also posted a link on our website, fox5sandiego.com. You can go there right now. Click on that Scene on tab. Raul, how your cheeks doing, baby?
I'm honky-dory over here. All right, thank you, guys.